the IMbrave050. This is a phase 3 trial of adjuvant atezolizumab plus bevacizumab versus active surveillance in patients with high risk of recurrence following surgical resection or ablation. As you know, currently there is no proven adjuvant therapy for patients who have just undergone resection or ablation in HCC. And because of that, the recurrence rates after resection is very high. And what this study aims to do is to see whether the therapies, atezolizumab and the used together, can reduce recurrence and improve the recurrence-free survival of the patient. And the IMbrave050 enrolls patients at high risk of recurrence. And these are patients with larger tumors, with multiple tumors, with vascular invasion, or with poor differentiation on the pathology. The trial at its first interim analysis met its primary endpoint of recurrence-free survival with a hazard ratio of 0.72 and a p-value of 0.012. Landmark analysis at 12 months in the trial shows that patients with atezolizumab and bevacizumab has a recurrence-free survival of 78% versus 65% for patients on active surveillance. An independent review facility also showed that recurrence rates were very different. Recurrence rates was 34% for patients on active surveillance versus 20% for patients on atezolizumab plus with bevacizumab. And the patients are quite balanced between the two arms of the trial. And when we look at the subset analysis, it is quite interesting to note that the recurrence-free survival benefit seems to apply equally to all the major clinical subsets. And this is specifically so for both patients with viral hepatitis HCC and for those patients with non-viral hepatitis HCC, both of which seem to benefit from atezolizumab and bevacizumab. And this recurrence-free survival seems to be particularly enhanced in patients with larger tumors and patients with more number of tumors. The duration of treatment for the patients on the 050 was 11.1 months for atezolizumab and 11 months for bevacizumab, and this was significantly longer than what we saw for the previous IMbrave050 using the same drugs. But in spite of this longer duration of treatment, we do not see an increase in the AEs. The AEs which were significant, of which were seen in more than 10% of patients, was higher in the group of patients with atezolizumab plus with bevacizumab. And the important ones were the AEs of proteinuria, the AEs of hypertension, the AE of decreased platelet count, and also derangements in liver function. So in summary, this is historically the first positive phase 3 trial of adjuvant therapy in patients with HCC following surgical resection or ablation. There is a significant improvement in recurrence-free survival in this trial. The overall survival data was still immature at the time of this first interim analysis and will require longer follow-up time. And the adverse events we see are what we expect to see with these drugs and with the disease indication. And atezolizumab and bevacizumab will very likely be a standard of care for patients with surgical resection or ablation as adjuvant therapy and may change clinical indications for surgical resection in this group of patients. Well, given the fact that there was no previously proven adjuvant therapy in HCC, this constitutes a very important unmet clinical needs for patients with primary liver cancer. Essentially, previous to this, if you had liver cancer and you have undergone liver resection or ablation, there was no therapy that could be used that can prevent recurrence or delay recurrence. So this trial provides the first effective therapy in this indication. And because of that, there is every expectation that this will impact on clinical management in the future.